Falls now kill 78.4 people per 100,000 over 65 every year in the U.S., and the joint that physically catches you in the first split second of a stumble is the one no fall prevention program teaches you to train. Your ankle is the first joint to respond when you stumble, firing a split-second correction before your brain has even registered the trip. But after 65, that joint quietly stiffens, its range narrows, and one day its correction arrives a fraction too late. Today, you will learn exactly why that happens, how to test yourself right now, and 5 standing moves that physical therapists use to restore what age has been taking, no floor, no equipment, and no excuses. Here is the number that should change how you think about every step you take. The CDC confirmed that the fall death rate among adults 65 and older rose 21% between 2018 and 2024, reaching 78.4 deaths per 100,000 older adults. That is not a hip problem or a vision problem alone. It is a whole system failure that starts lower than most clinicians look. The ankle is the body's first line of correction when balance is disrupted. It fires faster than the hip, faster than the core. Research published in Physical Therapy Journal confirms that ankle-foot control is essential to maintain balance and gait stability, and that control depends entirely on one thing: how much range of motion that joint still has. Yours probably has less than you think. The test that proves it is coming in 60 seconds. Stand barefoot facing a wall. Place your foot 4 inches from the base. Now push your knee forward and try to touch the wall without lifting your heel. If your heel rises before your knee reaches the wall, your dorsiflexion is restricted. Clinical guidelines are clear. Walking, descending stairs, and kneeling all require a minimum of 10 degrees of ankle dorsiflexion, while normal healthy function sits between 10 and 20 degrees. Lose that range, and your body compensates automatically. Heel lifts early, foot turns outward, stress shifts up into your knee and hip. You do not feel the ankle failing. You feel the knee aching, the hip tiring, the balance going, and you blame everything except the joint that started it. If the wall test just revealed a gap, stay with us. The reason it happened is stranger than you expect, and fixing it is faster than you think. Age does not just weaken muscle, it changes the tissue surrounding the joint itself. Research on aging adults shows that ankle dorsiflexion, plantar flexion, inversion, and eversion all decline measurably with each decade. 2 structures drive most of the restriction: the gastrocnemius and the soleus, the 2 muscles of your calf. They are direct antagonists to dorsiflexion. When they shorten through years of sitting, poor footwear, or a past ankle sprain that never fully healed, they pull the joint into a permanently restricted position. A healed ankle sprain can tighten the joint capsule and deposit scar tissue that silently caps your range for years. Meanwhile, the ankle's proprioceptive nerve endings, the sensors that tell your brain where your foot is in space, lose sensitivity with age, compounding the mechanical loss with a neurological one. That dual failure is why a stumble that a 40-year-old corrects in a stride becomes a fall at 70. Sit tall in a sturdy chair, both feet flat on the floor, hip width apart. Press through the balls of both feet and raise your heels as high as they will go. Pause 1 full second at the top, then lower slowly over 3 seconds. That slow lowering is the work. The soleus and gastrocnemius are lengthening under load, which is more effective at restoring range than a passive stretch held cold. Do 15 repetitions. You should feel the effort in the back of the lower leg, not the front. If you feel nothing, slow the lowering phase down further. This single movement trains both plantar flexion strength and the neuromuscular timing that catches you mid-stumble, because catching a trip requires your calf to fire hard and fast. 2 sets of 15, rest 30 seconds between sets. Keep your spine upright, do not lean forward to cheat the range. The next move opens the door the calf raise closes. Stand behind your chair and hold the back with both hands. Lift your right foot just off the floor and draw 10 slow full circles clockwise with your toes, then 10 counterclockwise. Make them deliberate and large, You are training the full circumference of the joint's available range and waking up the proprioceptive nerve endings that aging has quieted. Then trace the letters A through E in the air with your big toe, each letter taking 3 to 4 seconds. This is not a warm-up drill. It is a precision neurological exercise. Research confirms that limited ankle dorsiflexion is directly associated with gait control disorders and fall risk in older adults, and that the neural component of that control is as important as the mechanical range. Switch to the left foot and repeat. Place equal weight through both hands on the chair. Do not favor one side. Done daily, this 5-minute habit begins restoring the joint awareness that every safe step depends on. Move 3. Standing gastrocnemius stretch. Face the chair, step 1 foot back 18 inches. Keep that back knee straight. Press the heel firmly into the floor and lean gently forward until you feel a stretch in the upper calf. Hold 30 seconds each side. Move 4. Soleus stretch. Same position, but now bend the back knee slightly. That shifts the load from the gastrocnemius to the deeper soleus, which is the tighter of the two in most older adults and the one more directly tied to ankle joint capsule restriction. Hold 30 seconds each side. Move 5. Heel walks. Step away from the chair, lift both forefeet off the floor, and walk forward on your heels only for 20 steps. This strengthens the tibialis anterior, the muscle on the front of your shin, which decelerates your foot on every heel strike. A weak tibialis anterior is a direct contributor to foot slap and stumble. These 3 moves together address the full mechanical picture, and they take under 4 minutes. Fear of falling already affects between 35 and 55% of older adults, and that fear itself accelerates the decline. Restricted movement tightens the joint further, weakens the calf further, and narrows the world further. The 5 moves you just learned break that cycle at its mechanical root. Done daily, this sequence takes 8 minutes and requires only a sturdy chair and a wall. The research base is clear. Ankle foot exercises are associated with improved balance, stronger ankle output, and better gait stability in older adults. None of this requires a gym, a personal trainer, or getting down to the floor. The ankle is the forgotten joint because most fall prevention programs forget to look down this far. Now you know where to look and what to do when you get there. If these moves helped you today, subscribe so you never miss the evidence that keeps you moving. Drop a comment below. Did your wall test reveal a restriction? We read every one.